All right, hey everyone. So welcome to my mini case presentation. So this video is going to be about 10 minutes long, and I'm going to be going over a case from my current internship that I'd like some feedback on. It was a little hard to choose a client because I have questions for a few of them, but I thought that this one would be the most interesting for the class, and it's one of the ones that I'm kind of struggling with the most. So at the end of the presentation, that's when I'm going to ask my questions, and I chose this case also just to gain a new perspective in my work with this client. I've kind of come to a spot where I'm not quite sure what to do next, so hopefully you guys can help out. So I'm currently interning at RMEAP, which is Rocky Mountain Equine Assisted Psychotherapy. So we provide mental health services to individuals, youth, families, and groups in a therapeutic private ranch setting for up to 40 clients per week. So right now we just started group work again, but this is an individual client, which I've been working with her for a few months now. And I see her usually once a week. So I complete comprehensive clinical psychosocial intakes for all clients seeking services at RMEAP and develop individualized treatment plans to meet goals and address emotional and behavioral needs. I'm going to explain, or in a little bit, I'm going to let you guys know like what her individualized treatment plan is that I made for her, just to see what you guys think about that as well. So we also address clinical needs through cognitive behavioral therapy, relational therapy, psychoeducation, client-focused, and strength-based approaches, and equine-assisted learning therapy. So it really gives our program gives clients the opportunity to work towards healthy relationships and learn new coping skills every week. So everyone usually asks me why horses. Like, what does that have anything to do with therapy? And I actually have, really grown to love horses and integrating them into therapy. I think working with horses allows for clients to work on their challenges and skill application during sessions. And I think that can directly transfer to use these coping skills outside of sessions as well. I think horses also provide clients with a consistency of responses that are immediate. Horses are in the moment animals, and it's really cool because a lot of times they can sense, how clients are feeling, and they'll react, towards that. So they offer honest feedback, which helps clients understand how they influence, create, and maintain relationships. So it's a really neat thing. So clients can explore their boundaries, personal awareness, safety, and relationship patterns. Now, case information and history regarding this client. So the client I'm focusing on for this presentation is a 17-year-old Caucasian female who lives with her mother and her mother's boyfriend in a 2-bedroom apartment. My supervisor and I have conducted the intake with this client at the ranch. Her appearance at first, it's clean, presentable. She was oriented to time and place. The client was engaged with us, evidence in her willing to answer all the questions that we had for her and that we asked. She maintained her direction of thought when speaking, despite the presence of her mother. So at first, it seemed like they could have had a decent relationship, but the more time I've spent with this client, the more I realized that she would like to work on her relationship with her mother as well. So during the first time we saw her, the client showed emotions at times throughout the interview, most evident in her pausing before answering a question and shaking her leg from time to time. She seemed a little anxious. So she came to Rocky Mountain Equine Assisted Psychotherapy to work on building her self-esteem and learn new coping skills. So after the intake, it was clear that she had some presenting issues. Let's see. So family-wise, her biological mother of the client is currently pregnant with her second child. So now she's going to have a sister, and she's excited about that. But her biological father of the client lives in Florida and does not have a good relationship with her at all. She does not want really anything to do with him. Social history, client reported that she was born in Florida and left when she was about 6 years old after her grandfather passed away in 2006. Her biological mother and her father broke up when they were pregnant with the client, but mother mentions her father was still a part of their lives At the time, client reports she does not have a good relationship with her father because he only texts her during the holidays. The last text she received was around Christmas. Client acknowledges that last time she saw him in person was about a year and a half ago, where she went to Florida to visit her father for a few weeks over the summer. However, she just felt super out of place. She mentioned she would hang out with her father's girlfriend and her children while her father was at work, and stated they would all gang up on her for not staying the whole time, since she wanted to leave early because she felt uncomfortable. So client mentioned she wanted to leave the visit early, and yeah, so so there are a lot of relationship issues that she would like to work on within her family and outside of family as well. So client mentions her depression started in middle school, where she was bullied and had no friends. She eventually changed from going to public school, where the bullying and depression increased. She said she was teased a lot, would ditch classes, her grades were dropping at the time. Client expresses when things got bad enough, she changed to a different high school, but that didn't seem to help things. Her problems still followed her since she wasn't dealing and coping with her problems. So she experienced depressive symptoms such as feeling insecure, feeling excluded, crying a lot, not like sleeping that well, lack of appetite, insomnia, being fidgety. But she does have, so when we're thinking about her support system, in school, she does have two best friends. One of them goes to school with her, the other does not go to school. So there's a little positive peer and not so positive peer. But client reports she's tried therapy before with a therapist at her pediatrician's office, but she did not connect with the therapist at all. And so she wanted to try something new with this equine assisted psychotherapy. Substance use. So client states she drinks alcohol, smokes marijuana, smokes cigarettes as a coping mechanism to alleviate stress. She mentioned she drinks alcohol twice a week and gets tipsy. She says she does not feel great about drinking habits, but because she does not want to turn out like some of her family members who are alcoholics. However, she enjoys drinking and feels it is something she can do with her friends. So clients mention she smokes marijuana every day, sometimes in the morning for her nausea, but mostly in the afternoons to help her with her appetite after school. Client reports smoking cigarettes every few days as a way to release stress. She also mentions that her ex-boyfriend smoked methamphetamines. So that kind of sums up the substance use there. And then when we're talking about the mental health and trauma history diagnosis, client reports she's received a previous diagnosis of depression, anxiety, and self-harm at Parker Pediatrics. She was taking Zoloft, but recently changed to Lexapro for anxiety. She mentioned she's not great at taking her medication and gets impatient when she doesn't see results quick enough. She also states that she's experienced 2 suicide attempts since 2004. She mentions the first suicide attempts was she was talked out of by jumping off a bridge by one of her best friends. Client reports not remembering the entire experience except for that she was depressed, felt excluded, and had a horrible day at school that day. She states she experienced conflict that day with a guy at school, and this seems to be a common theme for this client, is that every time something goes wrong with a boy or with a peer, that she really takes this personal, and this is a trigger for her, for this client. This is something that we've been working on within the last few sessions, which I can explain a little bit more in a little bit. And so client also reports she cuts herself with razor blades and says she cuts herself every couple of weeks as a way to release her emotions. The last time she cut, she said, was about a month ago. However, near the end of the intake, the client did create awareness of a razor blade that she had inside of her phone case. So she ended up giving that to her mother right then and there. She reports having one traumatic experience where she had forced sex with a past partner when she was 16. Client acknowledges she has nightmares every couple of weeks. She states that the partner who was involved in this traumatic experience is wanted for intimidating witness, setting off fire alarms every day, at their apartment, and tagging and threatening. So she mentioned she thinks about him once a week, especially when depression worsens, when she thinks of all the mistakes she's made. So these are all things that we're trying to work through in equine-assisted psychotherapy. So the client family identified goals that they've written down is to identify triggers. that make her feel like there's no way to vent, find healthy coping skills, prioritize goals, and a few of the different goals is to decrease alcohol, marijuana, cigarette use. Obviously, cigarette use is not one of the biggest ones, but we're still putting it in there. Is that something that she wants to work on? Decrease cutting and scratching. Take prescribed medications from doctor on a weekly basis or a daily basis, whatever that is. Decrease anxiety and depression. Decrease self-harm behaviors. And another big goal for her is increase self-esteem, like forgive herself, realize that what the client has control over and what she doesn't have control over. And so with all that information, I kind of targeted 3 big target areas. So problem number 1, anxiety and depression goals. I want to help the client decrease symptoms of anxiety and depression. So problem number 2, self-harm goals. I want to process and decrease self-harm behaviors and its impact in the client's daily life. Problem number 3, low self-esteem goals. I'd like to explore reasons for her low self-esteem and develop ways to increase her self-esteem. So for the intervention, client has attended weekly equine-assisted psychotherapy sessions. We've taught her weekly coping skills. We've worked with the client, her relationship with her horse, to help client understand her relationship patterns with humans and process client's feelings of anxiety, depression, and any self-harm behaviors in the office, with potential for these feelings to come up around the horses as well. And we try to assign homework each week just as a little something for them, to work on when they're not in therapy. And if they do get triggered, they have something to go towards. So kind of like a weekly plan. And we have also a process with client each week about progress made toward her goals, if she has any new goals, if she wants to make any changes. So we're constantly catching back up, going back and making sure that everything's still going well for her. All right, so let's see. So the goals have been measured by self-report from client at the beginning of each session regarding all the coping skills that she's using outside the barn, self-report from client at the beginning of each session regarding the client's feelings of anxiety, depression, any self-harm behaviors. I'm trying, with my classes and my internship, I've been trying to use different type of therapies and practicing them on different clients if I find that it's going to be helpful for them. So I've been trying to use cognitive behavioral therapy. I think this one is really good for this client, as I think that the more she realizes that her thoughts and feelings are connected to her behaviors, the easier time she's going to have of stopping those negative thoughts and changing them into something more positive so she doesn't act out in those negative ways. Relational therapy is a big one. Psycho education, client-focused, strengths-based approaches. That's a really good one since she has low self-esteem. I'm trying to raise her self-esteem by realizing how many strengths she does have, because she has plenty. Equine-assisted psychotherapy as well is what we're doing with the horses. So I think it's super important to integrate the client's strengths into the intervention process to overcome a lot of her challenges. So her identified strengths that I've been able to identify so far is she's able to vent and communicate with her best friends about her emotions. So she is talking to people, and she has internal coping strategies. She likes to watch Netflix, meditate using meditation guide on the phone. She likes to paint. She smokes cigarettes. It's not necessarily a positive coping strategy, but that's one of the things that she does. Hobbies: she likes art, going to concerts, photography, wants to travel around the world. Identified support so far: her mother, her grandmother, and her best friends. Those are the 3 that she would say, or the 4, I guess, technically, because there's the 2 best friends that have been huge supports for her throughout this process. And outcomes thus far: so shifts, client has realized that she has a stronger relationship with her horse by setting good, and healthy boundaries. This client has really struggled with setting healthy boundaries with her peers, and she usually kind of lets them just do whatever and lets them, they'll use her, whether it's, just hanging out, going to see a movie when they feel like it. And then when she wants to do something, it's not, it's not reciprocated. And so she's learning that it's okay to make healthy boundaries, especially with boys. That's something that she has a hard time doing. So I think that seeing her make healthy boundaries with her horse has made it easier for her to practice and use this outside as well. So she has created a safety plan to keep herself safe when things don't go well with the boys, since she knows that is a trigger for her depression. A pattern is that she has a hard time setting appropriate boundaries with others, like I was kind of saying before. So I guess for me, I just want to know what you guys think about this client, and if you think, like, what social work theories would you use with this client? I know I've named quite a few. And then any suggestions on how to support change and or how to build self-esteem with this client. If you guys have any activities that would be helpful or any tips. And then for the third question, one of the client's main triggers for her depression is negative experiences with boys. So how would you go about the conversation of the differences between healthy and unhealthy relationships? I guess so those are my 3 main questions. So I guess I will post those on Blackboard right now, and I hope that you guys have the great rest of the semester. Good luck with all your assignments. We're close, guys. All right, bye.